Hello, my name is Amanda Fahrendorf, and today I'll be addressing mental health backlogs in Missouri's jails. So right now, jails are overcrowded with individuals suffering from serious mental illness. A lot of these individuals are just waiting for evaluations to see if they're competent to stand trial. Instead of receiving timely mental health treatment that could help stabilize and avoid returning to jail, they just remain in this cycle. There are a staggering number of individuals with mental health disorders in prisons, where many end up due to the lack of supports early on. There's over 50% of people in state prisons that had some indication of mental illness. Also, there's only about a fourth of those individuals have actually received treatment while in prison. There was a lawsuit brought by the MacArthur Justice Center Arch City Defenders and the ACLU of Missouri, alleging that the department has illegally denied timely evaluations and services for mental health and cognitive disabilities who stand accused of crimes, essentially turning jails into de facto mental health wards. Here's 3 examples of individuals that had to wait for evaluation and/or treatment while in jail. The 34-year-old man waited 472 days, a 31-year-old man waited 445 days, and a 64-year-old man waited 304 days just to access treatment while in jail. At the same time all of this is going on, nursing homes are housing individuals with severe mental illness because there is nowhere else for them to go. In 2023, the Department of Justice released a report identifying 3,289 adults with mental health disabilities, excluding those with Alzheimer's and dementia, who had spent at least 100 days in Missouri nursing homes. In some facilities, more than 80% of the residents have bipolar disorder or schizophrenia. Yet, most of these facilities only provide minimal mental health supports beyond the medication management. There are limited mental health hospitals or institutions in Missouri, which are really mainly used to house the mentally ill individuals who have committed a serious crime. Since the deinstitutionalization of public psychiatric hospitals in the 1950s, our nation's jails have become the largest de facto mental health care providers. What are some of the potential solutions? Stepping Up is a data-driven framework that assists counties through training, resources, and support that are tailored to meet local needs. Since 2015, more than 500 counties across the country are participating, where they have implemented mobile crisis and co-responder teams that include mental health professionals, diverting people from booking, embedding treatment in jails, and creating new accountability measures to track and improve outcomes. There are many reasons for the limited implementation of the Stepping Up program in Missouri. There's a severe shortage of staffing and resources, massive mental health backlogs, state hospital capacity and bed limits, data and technology gaps, rural implementation challenges, and then there's slow program rollout. There was an article published in 2025 titled "Missouri Lawmakers Vow to Tackle Mental Health Backlogs as Hundreds Languish in Jails," citing 3 bills that have been introduced. 2 add requirements for consequences to the Missouri Department of Mental Health, and 1 requiring court-ordered involuntary outpatient treatment before being charged. Another proposed solution included Cape Girardeau County, Missouri, where they constructed a new jail but included 2 dedicated mental health pods. The pods held 28 single bed cells equipped with cameras at a cost of additional $7.5 million. The county is now seeking reimbursement to offset the ongoing expenses of housing individuals with mental health needs, including the medication and additional staffing. Here are a couple suggested solutions to be funded. Fund the development of the mental health pods similar to the model implemented in Cape Girardeau. These pods would allow individuals with mental illness to be housed separately from the general population and receive appropriate care. The Department of Mental Health could contract with vendors to administer screenings while providing oversight to ensure compliance. Through these contracts, staffing would be secured to conduct the necessary screenings effectively. Or implement and fund the Stepping Up initiative, a proven model for addressing mental health needs. This approach could include funding for construction of mental health pods in jails, as well as resources for mental health services, medications, and supportive programs. The Department of Mental Health could contract with vendors so they could administer screenings while providing oversight to ensure compliance. These proposals could be considered by first going through the legislative process. First, it'll be proposal initiation, where individuals or groups lobby to secure a legislator to sponsor or draft a bill. Bill is introduced during the legislative session. Step 2, the committee action. Bill goes to the committee for hearing, public hearings, discussion, and revisions. Step 3 is the floor vote. Bill must pass both chambers, House and Senate, and requires a constitutional majority. And step 4, the conference committee. If the House and Senate pass different versions, a conference committee reconciles differences, and the final version goes for approval. The executive branch, the governor, may sign the bill into law, allow it to become law without signature, or issue a veto. The rulemaking process. Once the law is enacted, state agencies under the governor's authority develop regulations and rules to implement and enforce the law. And then there is the judicial branch. The judicial branch is only involved after the law is enacted, where they can interpret the law or litigate the law. So if a group comes and says that they don't agree with the law, this is when there would be some type of litigation, and either the court upholds it or they invalidate the law. So in conclusion, what I think is that we should allocate funding to develop and select a program that has been proven successful, that supports individuals in managing their mental health and building stable lives outside of jail. These programs should be flexible, allowing counties to select options that best fit their community needs and available resources. Additionally, counties should be given funding to create specialized pods or separate facilities where mental health professionals can screen individuals and begin treatment. Implementation should be tailored to each county's size and resources. To streamline this process, the Department of Mental Health should contract with vendors to conduct screenings within established timeframes, ensuring quicker progression through the system. And the department should provide oversight and track outcomes to guide continued funding. Thank you.